Welcome to Medical Marijuana and Wellness. Today's topic is medical marijuana terminology. This is a subject that I get a lot of questions about, and many people that are getting into the medical marijuana world, just like the world of athletics, just like the world of religion or church or whatever, every one of these organizations has a set of terminology. Cannabis does too. And that's what we're going to talk about today, or what are the terms that you should look for. And joining me is Manny Alfinez. Manny, thank you very much for joining me.
Always a pleasure to be a part of the team, Mark. Glad to have the invite and share some knowledge from the blunt joint.
So let's jump into terminology for a second. And I know that when we talk about terminology, there are a lot of different, let's just say, definitions that are out there. I know people talk about legal definitions, which are used by the state and federal law courts. There's practical definitions of what people use on a daily basis. There's colloquial definitions of what they use in certain areas and regions. And also there's the old corporate definitions. These are the ones they use to brand the names of products and things like that. But also the state of Florida has come up with their own set of definitions. For example, with some of the statutes.
Absolutely. They actually separate marijuana and cannabis to mean slightly two different things as far as THC content. As stated in the slide here, cannabis meaning all parts of the plant, usually less than a certain amount of THC, whereas marijuana is going to have higher than 0.8% THC in it. But I believe we're going to dive a little bit more deeper into that as we go along.
But I mean, the definition between hemp and cannabis or marijuana is 0.3% THC or less is hemp. More than that is cannabis. And that really gets back into types of definitions that are out there. That is a legal definition, not necessarily a definition that you'd find in a grower, but it's something that we deal with when we're looking at handling medical cannabis. So what we're going to do today, Manny, is something that's interesting. We're going to talk about, when we talk about terminology, we're going to break it down into different use cases. For example, what terminology should you know if you're a beginner? What terminology should you know if you go to the medical provider's office? What terminology should you know if during the application process? What terminology when you're looking at going to a dispensary, and also when you're going through your journey? And I might point out that all these terms can be found in a glossary. We'll actually repeat this, and you'll be getting a copy of this in the follow-up. But I think this is important to follow out, that we've kind of made it easier for you to understand the different applications of the terminology. Now, let's talk about if you're a cannabis beginner. Manny, there's a lot of controversy about the different programs. Tell me about adult use medical marijuana and low THC cannabis.
I'd be happy to, Mark. So as stated, adult use is going to be referred to as the recreational cannabis term adult use, consumption of marijuana with the sole goal of achieving euphoric effects rather than treating a medical condition. Medical marijuana is what most of us are familiar with if you're within the program, the MMUR, Medical Marijuana Use Registry, or the Office of Medical Marijuana Use, and is the use of cannabis plant or components or extracts in order to treat illnesses or ailments. It's a state-issued medical marijuana card that gets achieved through a physician's recommendation, which we'll go over a little further later in the slideshow. And then low THC cannabis is a cannabis flower that contains less than 0.8% THC and more than 10% of CBD. Many CBD dominant products are also low THC products, which you could find in dispensaries as well. And basically, the low THC cannabis is not going to give euphoric effects or possibly low euphoric effects, whereas medical marijuana or adult use will provide those euphoric effects, all of which can be found at a dispensary if Amendment 3 passes in this upcoming election or this upcoming ballot. And that will also make it more, the word I'm looking for, official, if you will, where you can find products of quality and of little to no mycotoxins, heavy metal, pesticides, or adulteration to those products.
Now, I should point out that when we use the word dispensary, this is a Florida state licensed cannabis retail store. So Florida State, the OMMU, actually issues these licenses. And there's also a term that people will run into called reciprocity, meaning if you have a medical marijuana card here in Florida, can it be used in other states? Florida does not recommend or does not recognize medical marijuana cards from states outside of Florida. However, I do know myself, I've used my Florida medical marijuana card in places like California, for example, and in Nevada, where they actually will accept those cards. So you may be able to use it in states outside of Florida, but inside the state of Florida, you have to be able to have a Florida issued card if you're coming from another state. And again, we have a whole webinar on that, and here's a bit.ly that you can take a look at down here on that particular subject.
And a little last note on that reciprocity, Mark, is that also if you do use it out of state, like you, myself being self-aware and using it in other states, it doesn't count against your recommendation in Florida. They do not deduct the milligrams from you out of state.
Good point. Good point. So Manny, we hear about terms like hemp, cannabis, marijuana. We talked about 0.3% or 0.8% THC or less being hemp. Tell me a little bit about how we define those two different terms, or all these three different terms.
Absolutely. So cannabis is the umbrella term for all parts of the plant. For most purposes, marijuana and cannabis are synonymous, as it states. However, by legal definition, 0.3% or 0.8%, also depending on the state. Here in Florida, 0.3% marijuana or marijuana contains more than 0.3% THC, excuse me, and can induce psychotropic or euphoric effects, whereas hemp does not and contains less than 0.3%. There's also physical appearance differences. Again, this is a very broad definition because the physical appearance doesn't necessarily dictate if it's going to fall under the marijuana umbrella or the cannabis umbrella. It's all based on that legal jargon of the percentage of THC that's in the product.
Right.
However, marijuana is usually bushier, fuzzy buds. It's got more THC in it, more trichomes, whereas hemp is usually tall. It's also used not just for medicinal reasons, but also for common causes or industrial reasons such as rope, paper, cleaners and stuff like that. Legally, marijuana is medically legal in 33 states, recreationally legal in 11 states, possibly 12 with Florida on the ballot, and is illegal, though possibly being rescheduled at the federal level.
And this is a perfect example of the legal definition of marijuana and hemp based on the percentage of THC versus the grower's definition, somebody who's actually growing it, where they look at the actual, like I say, one's a bushy plant, and one's a weed, and the other one's a tall, skinny plant. So these are perfect examples of how the different types of terminology come into play, but they are basically all under one family of plants called cannabis. Cannabis is made up of both hemp and also marijuana. And that's something that's important to understand. Now, tell me about the main components of cannabis, because this is really the trick to the whole why use cannabis.
Absolutely. So you have the main components of cannabinoids, terpenes, and flavonoids, which is just the three main topics, if you will. However, I like to use an analogy where if you were using, or a metaphor, where you're ordering spaghetti and meatballs, you want a full dish that is going to be complementary to your palate and what you like. So for instance, you have pasta and meatballs, your CBD and THC, your cannabinoids. Then you have your terpenes, which would be the sauce. Then you have your flavonoids, which would be your additional flavorings or condiments such as Parmesan cheese or salt, pepper, otherwise. And that complete dish gives you, if you can see on your slide here, that marijuana leaf that's in the middle of those circles, cannabinoids, terpenes, and flavonoids, that is the complete dish. You can have them separated. However, it's not going to give you the entourage effect or synergistic effect of what you're possibly looking for. You wouldn't necessarily want to eat just pasta and meatballs without any sauce, or you prefer red sauce rather than white sauce. And all that plays a role on how it's going to affect your body, just as if how much you would eat, if at all, when that dish is served to you. But cannabinoids are basically your primary THC, CBD. There are other cannabinoids that fall under that umbrella, but those are the two main known. And your terpenes give it that aroma and also drives the effect of those cannabinoids on how beneficial it's going to be in the body. And the flavonoids can give it some flavor, as it suggests, but it also has the color, aroma, taste, and dictates some of the effects of the cultivars or strains that are out there.
And all three of those working together create what they call the entourage effect. Now, the entourage effect, in essence, means that if you use cannabis and cannabinoids and terpenes together, it kind of boosts the medical efficacy of both of them together. And that's really, really important to understand. Let's talk about something else here for a second. You talked about the major cannabinoids that are here, THC and CBD. Tell me a little bit about those, because they actually tap into the CB1 receptors and the CB2 receptors in our bodies.
They do. And actually, to give an explanation of the receptors, we all have CB1 and CB2 receptors throughout our body. CB1 primarily in the brain and the spinal cord, and then your CB2 in the peripherals. And THC directly reacts with both, but primarily with CB1 receptors in the brain and the central nervous system, which gives you that euphoric effect. CBD primarily reacts with the CB2 receptors and does not give that euphoric effect, and why it's so beneficial for the peripheral parts of the body, like your legs, your arms, and so forth. However, these cannabinoids actually work against each other as well as with each other. And what I mean by that is CBD can inhibit the effects of THC. And then there's another one like THCV, if you're dabbing or using concentrates, which we'll dive a little deeper into later. THC actually inhibits the effect of THCV and vice versa. So that's why it's important to understand the jargon and the concepts so that you can find the products you're looking for.
Sure. And CB2, when you use them together, THC and CBD, the CBD lessens the euphoric effect of THC. You won't get as high by putting them both together. And that's something that's
Correct.
important when you're a medical marijuana user, because you're looking for treating your condition, not necessarily getting high. But the real benefit here is we hear about the endocannabinoids and phytocannabinoids. Our body produces endocannabinoids. That's how your body manages itself. That's how it manages your pain, your anxiety, your memory, your appetite, inflammation, your immune system. But phytocannabinoids are interesting because don't they almost mimic or work directly with endocannabinoids?
That's exactly what they do. They molecularly look pretty much identical. The difference is endo being within the body from your internal pharmacy, if you will, that your body naturally produce, like anandamide and 2-AG. And then you have THC and CBD, which are phytocannabinoids, meaning they're directly affected by sunlight or light, and they produce their medicine that way. And when you take it, it's a supplement to the body rather than just a straight up synthetic medicine. So those are interchangeable in the sense that endocannabinoids are molecularly the same as phytocannabinoids. However, one endo coming from the body and two phyto coming from outside of the body and more from a light source.
And the main reason why you'd want to use cannabis is because I'll take myself as a senior citizen. I don't produce as many endocannabinoids as I did when I was younger. And more importantly, I don't produce them as fast. And so when I have inflammation, when I have pain, even anxiety and stress, those phytocannabinoids, when I take cannabis, get stored in my fatty acids. And when I do have those particular conditions like inflammation, my body says, oh, we got inflammation. Houston, we have a problem. Let me produce the endocannabinoids that I need. So it reaches into my fatty acids, grabs those phytocannabinoids, produces the endocannabinoids that are needed, and my body now has basically the energy or the batteries that it's needed to be able to allow the body to do its job and provide its healing ability. So it's a very natural way of working. And the nice part about it is being natural, it's very safe. Now, also, you talked a little bit about terpenes. Terpenes are really where the medical value comes from.
Absolutely. I like to say that it's what drives the bus. Meaning you could take pure THC or pure CBD, but you're not necessarily going to know how it's going to affect you without the terpenes as well as the flavonoids. And the terpenes are usually less than, I would say 3 to 5%, give or take, in any given product. But that small amount or that small percentages has a significant impact. And depending on which terpenes you get within that product, which you could find on a COA or certificate of analysis, which we'll go over, you'll be able to dictate what effect you're going to get from depending on the certain terpenes. And as you can see, the three listed there, like pinene has analgesic effect or analgesic pain relieving effect, relieves stress, anxiety, bronchodilator, improves short-term memory. However, that can also induce some anxiety if you take too much of it. And we'll go more into the dosing and how that works as well.
And I point out that there are 20 main terpenes that are out there that we've discovered, but there are over 200 of them that they in the whole population pool of terpenes. So there's a link at the bottom about the terpene toolbox. Please reference that if you're looking for more information about terpenes and which ones can help you with your particular conditions. So now let's just switch our focus a little bit. I'm now going to my medical provider to get a medical marijuana card. What terminology do I need to pay attention to? And naturally, I think we all know the qualifying conditions. But the main question that at least I get, Manny, is what's the difference between a recommendation and a prescription? Because we get prescriptions from a doctor, but when you go to a medical marijuana doctor, you end up with a recommendation.
Absolutely. This is one of the bigger questions I always get, or what I'm correcting people on, that it's not prescribed, it is recommended. And the biggest part of that, as it states, a marijuana doctor cannot prescribe marijuana because prescription drugs are regulated by the federal government. Cannabis is illegal under federal law, therefore they cannot prescribe it, they can only recommend it. And based off of that recommendation that they put into the Medical Marijuana Use Registry, or MMUR, is what allows you to get the license from the state, and then the patient also gets routes of administration with limits. But and the biggest part of that is that when you get a prescription, you're pretty much directed on what to take, when to take it, how long to take it, and so forth. Whereas a recommendation, you're going to get those routes of administration to the right, and you're going to get an allowance within those routes of administration that can be manipulated by the physician only. And then it's up to the person or the patient or the consumer to try to find which products are going to work in tandem, isolated or otherwise, whether it be edibles, vaporized products, smokable marijuana, or otherwise. A note on this is at one point, all consumers were able to go to a dispensary, and some products would fall under different routes of administration, particularly between sublingual and edibles. or orals. And at that point, if you were running low on a certain route of administration, you can ask the dispensary to put it under a different route that was legal. There's a new update coming down from the MMUR that suggests that that won't be allowed anymore, that any alterations or changes would have to come through the physician's office directly.
Yeah, that's a good point. But the point is, you can get what you need. You need to be able to know what your limits are. And we'll talk a little bit about how you find those out in just a moment. So we talk about basic consumption methods. We're talking about how you use the product. And I know there are different consumption methods. There's oral, sublingual, inhalation, and topical. But each of these have subcategories. Like oral has a subcategory called capsules and edibles. Tell me about some of these.
Absolutely. So orals, I like to describe orals as more of things that you're actually going to chew or consume that doesn't get absorbed sublingually under the tongue or within the mouth mucosis. So sublingual is just that. It's a liquid. So yes, you do swallow, but most of that absorption is under the tongue or within the mouth. Those are usually tinctures, sprays, and so forth. Whereas orals could be chocolates, gummies, hard candy type products. And then the other one that you see there is inhalation, which flower does fall under, but flower is separate from inhalation. It's under a smokable route. So you have smokable and then you have inhalation. Smokable is going to be anything that's actual flower, whereas inhalation is going to be something that was derived of the flower, such as vape carts or concentrates or otherwise. You also have topicals, which are just as they suggest, they're rubbed on top of the skin. They don't necessarily get into the blood vessels, all of them, unless they say transdermal, such as patches, or if they say encapsulated, then it's a little bit different. It gets into the bloodstream through the skin. And then there's a few other routes as well, but it's all going to be generalized under what products you want to get. And the dispensaries or the medical marijuana treatment centers will be able to help you navigate which way or what can go under what.
Sure. And here's some examples of the different definitions for things like capsules, edibles, tinctures, sprays, flower. I think you were going through a few of those when we were describing them.
Yeah, some of the bigger ones, the ones that most people get confused on, are inhalation and flower, because you do inhale flower if you're smoking it. But a lot of people do different things with flower. They can cook with it. They can do extractions with it, depending on the devices they get on over the market. Whereas vape pens, as well as dabbable concentrates, would fall under inhalation. And then, of course, you have other products that go that way as well.
Sure. And I think the most popular ones are the edibles, the tinctures, and also the flower. I think those are kind of the main ones that are out there. But I wouldn't overrule, or I wouldn't, if you're looking at medical cannabis, depending on your condition, I know I have inflammation problems. I use a topical gel, which works just great for me. Topical balm, actually, that works just great for me. So it's something you all might want to take a look at. Manny, there's an important part of this, though, is I'm now going to start my journey for medical cannabis, and I hear about this thing called dosing, which really helps me find my therapeutic dosing level. Why do I need to dose, and how do I get there?
Great question. I usually like to use alcohol with this as a metaphor. Drink too little, you don't get as euphoric as some may want. Drink too much, you're not feeling as great as you should, and you feel it in the morning. Finding that sweet spot is very important because it kind of applies with marijuana, or does apply with marijuana or cannabis, as well as the biphasic effect. Take a little bit, take your time, start low and slow, and once you start feeling it, is probably where you want to stop, if not a little before that, which is kind of hard to do. But that target range is going to be your dose specific or sweet spot that you want to use. If you don't do that, or if you take too much, you may deal with symptoms that you're not going to like. It may enhance what you're experiencing and make things worse. But it also can build up your tolerance, as it suggests on the right. The more you take, the more you're going to build a tolerance, the more you're going to need to take to find that sweet spot again. And that's not a pleasant journey to go on when you find something that works and then all of a sudden it doesn't work and you don't know why or how. And so that's why that target range or sweet spot is so important. Start low, go slow. Remember that inhalation, you feel the effect fast, but it goes out fast. Whereas if you ingest it, it may take longer to take effect, but it's going to last longer. So that's why you definitely want to start low and go slow.
And I might point out that this is no different than alcohol or tobacco or coffee or caffeine. Every person's body is different. Some people have a high tolerance for alcohol. Some people have a low tolerance for alcohol. I have a friend that has one martini and he's done for the night. I have other friends of mine that they can drink the whole bottle and they're just getting going. It's the same thing with cannabis. You need to find out for your own body what your tolerance level is for cannabis. And that's what we're talking about here, is everybody has a different therapeutic dosing effect. To take two pills and call me in the morning approach really doesn't work in general, much less here in the cannabis business. But it's not very difficult to figure out your therapeutic dosing level. It takes probably a week or two to be able to find that. But once you find it, I mean, when you start finding it, like in my case, I have herniated discs in my neck, which leads to inflammation and pain. When you start feeling it, when you start feeling the pain going away and the inflammation going away, you know it's working, and you know how much you took and at what frequency you took it. So you'll know when it's there. And then obviously, as Manny says, sometimes you may need to increase that depending on your tolerance level. That's something to really pay attention to. One of the other things that's recommended is to journal. Tell me a little bit about that, Manny, because this is an important part of your journey, is to keep track of what you're using.
It is, and the reason that is as I mentioned before, if you go to a restaurant, you're gonna want to know what products or what you got, because you're gonna want to go back and get it again. There's such a variety of products out there for anybody to use from different dispensaries that journaling makes it very possible and very likely that you're gonna find the chemovar or strain that you're looking for and be able to replicate that. So for instance, if you journal what you got and you look at the terpenes, the percentages of those cannabinoids and so forth, you'll be able to find another product similar, if not better, at a different dispensary. Let's say if they were out of stock of the product that you like. So being able to journal, being able to go back at your notes and see what you took, how you took it, under what dose or what percentage of product you took, is going to allow you to shop more effectively rather than shopping for discounts and having products sit on your shelf for about 3 or 4 weeks, if not longer, and then you end up throwing it away because you couldn't use it or didn't know how to.
And that makes a lot of sense. And by the way, these forms can be found. You can download them here at bit.ly/MM Treatment Journal, and you'll be able to pick up these particular forms that are out there. And again, it'll be mentioned at the end of the presentation as well. I want to apply for a medical marijuana card. What are the terminology I need to look at? Now, there are from the Office of OMMU, I'm going to let you define what they do. You really need to be able to find out if you qualify, which are those qualifying terms, get an appointment with a physician, a medical marijuana physician, more importantly, when it's been certified by the state, complete the application for the state registry, and then basically, once that whole process is put together, you'll be able to fill your order out at a state licensed dispensary. That's the process. But Manny, the OMMU is really critical. They're the ones that overlook the use of medical cannabis here in the state of Florida.
They are. And actually, they kind of are the overseeing parent here in Florida. And then everything's done through the Medical Marijuana Use Registry, which falls under that. And it's not where you need to have a recommendation from your primary care in order to go see a medical marijuana physician. This is all done out of pocket. There's no insurance as of yet that covers any of this. And what you would do is you would bring your medical records with your diagnosis to see if you qualify at the physician. And as you suggested, Mark, you get that initial appointment, you complete the application. And I know MMTC is really good about walking the patient through this so they learn how to do it and they know what to look for and how to look at it and what's identifiable through the medical marijuana use registry. But knowing that you're not getting a prescription, you're getting a recommendation. I haven't heard of anybody really yet that was rejected for any reasons, because you don't have to necessarily have one of those diagnoses on the list if you have similar or like symptoms to one of those diagnoses on the list. But starting that conversation with your medical marijuana physician or medical practitioner is the first step in finding out you qualify on what's required.
Yeah, there are about over 300 conditions that really qualify to get a medical marijuana card. The state of Florida did something I thought was pretty good, which is they came up with a list of qualifying conditions and then said to the doctors, if there are similar conditions to these, you can then go out and be able to provide a medical marijuana, put them in the registry and get them a card. Now, let's talk about caretakers, because this is important, because a lot of people need caretakers to help them. And there's a separate category for caretakers. Tell me about that, Manny.
Yeah, so caretakers or caregivers would have to go through an application process through the state. Primarily, it's easier if you're a close relative, mother, father, husband, wife, something to that sort. Be 21 years over. You cannot be employed or have economic interest in a medical marijuana treatment center, aka a dispensary. And to be blunt about that one, even if you work in a dispensary and don't have any oversight over whoever you're going to be caregiving for, you may be declined, as I was, even though I'm in IT for a dispensary. They disqualified me to care for my son, so my wife had to do it. But there are ways to dispute that. Successfully complete a caregiver certification every 2 years. It's about a 5 to 7 question test where there are study resources for that. Obtain and be in immediate possession of a medical marijuana use registry caregiver ID card at all times. Now, there's discussion saying that you can use your driver's license. Some dispensaries will be very strict and want to see that caregiver card, even though they could look it up in the MMUR. Not receive compensation or other actual expenses incurred for any services provided. So there's been suggestions that some people are, hey, I'll be your caregiver, I'll do everything for you, but you got to pay me for that. And that's basically what that's saying. You cannot be paid to be a caregiver for any person, let alone a close relative. If you are a non-close relative, let's say I wanted to be a caregiver for my brother or my sister or somebody that's distant in that sense, not in my close circle of immediate family, I would have to go through a background check by completing a CRAF form and then submit the full fingerprints, live scan provider. They'll direct you through that. And that could take up to 10 days, possibly a little bit longer for that to be approved.
And it's the same thing for both close relatives and non-close relatives that are there. So let's talk about now. I'm going to walk into my medical marijuana district. I got my card. I'm going to walk into a dispensary. Let's talk about the terminology that they're going to run into. These are kind of the main terms to look out for.
They are. And most people are semi-familiar with indica, sativa, and hybrid as the categories to look at for their product. However, that's very broad. That's like saying I like white wine, red wine, or rosé. You still have so many selections within that. However,
Sure.
letting the dispensary associates know whether you want to be in the indica, sativa, or hybrid category kind of gives them a good idea of what products to look at and what questions to ask to find out what you're dealing with or what you're suffering from to get you the best product for those symptoms or diagnosis. Now, you also have what's called I'm sorry.
And I think today they're really, there used to be products that were indica and sativa products. Now we have what they call indica leaning, sativa leaning, meaning an indica leaning product is one that relaxes you. Sativa is one that more energizes you. And of course, hybrid's a mixture of the two, because we've been breeding for the last 10 years a lot of medical cannabis for specific purposes, like anxiety and stress, like pain, like inflammation, that really has brought in these things called cultivars, which is a mixture of both the cannabinoids and the terpenes, which we'll talk about in just a moment. But I think it's important to point out, this is part of the world of cannabis evolving. And also part of that evolution is Rick Simpson oil, RSO or FSO, full spectrum oil.
He did. And everybody pretty much took it on, although most dispensaries may call it something different, like full spectrum oil rather than Rick Simpson oil. Both the same products. However, please keep in mind that RSO or FSO is not to be inhaled. It contains all the products of the plant, to include some of the stuff that was used to extract it within safe levels, which we'll see on the COAs or certificates of analysis. But that can actually injure you or hurt you if you inhale Rick Simpson oil. It's meant to be taken orally or topically, not to be inhaled.
And that's a good point. It really was designed for that. Do not smoke it. But it is because it is full spectrum, it is very powerful. I like to call it the 151 Bacardi of the cannabis world.
Absolutely.
And it's very effective at a lot of things. Now, when you talk about hemp, you hear about things like broad and full spectrum.
Yes. So, and you can even get those in marijuana as well. Full and broad spectrum. Well, let me start with broad spectrum. Is a term typically applied to CBD products. It means that the product was created in a way that preserves various beneficial compounds from the cannabis plant. Basically, they're not using chemicals to extract what they're looking for and then evaporating those chemicals out of it and then testing it. Full spectrum products maintain a variety of cannabinoids such as THC, CBD, CBG, and more, rather than isolating a specific cannabinoid like THC. So basically, like Rick Simpson oil would be full spectrum, or FSO would be full spectrum, having the totality of the plant basically within that concentrate, so you can use it to your benefit.
Sure. And each of them has pros and cons with respect to what different ailments that it actually treats. But when we're talking about products, you have something that's really important. I'm going to start with the one at the bottom, that's onset and duration time. And then let's talk about ratios and cultivars, because that onset and duration is really important for the different routes of administration.
It is. So as I was mentioning before, if you're inhaling a product, the onset time is going to be very quick. You should feel it within minutes. However, the duration is going to also be quick, somewhere between 45 minutes to 2 hours, give or take, and depending on the dosage that you took. If you're ingesting some cannabis or marijuana, then you're going to actually not feel those effects as rapidly, although it can onset within a half an hour, but it could take up to 2 hours, if not a little longer. But it's also going to last in the system significantly longer, which is why edibles or orals are really good for nighttime or sleeping under the indica category.
And this is where it may take the 2 hours to work, or maybe an hour in my particular case. but it'll last all night. It'll last 8 hours or 10 hours. And that's what's important, because if you take some other types of routes of administration, like tinctures, you'll only last for 4 hours. You'll wake up at 2 or 3 in the morning and you need to redose. So Manny, when you take a look at certain product ratios, this is really important to be able to figure out the right product that you're going to be using, and something you'll be asked for or could be asked for in the dispensary.
Absolutely. Actually, they might actually just suggest it for you depending on what you're asking or telling them what you're suffering from. And basically, the first number in a ratio product is going to be your CBD, and the second number is going to be your THC. And as you see in the slideshow, the 1-to-1 is going to be a 50-50, so to speak. And it's not going to have as significant euphoric effects, though it more than likely will have slight euphoric effects. The 1-to-9 is going to be higher in THC. That's equitable to maybe a 13 to 18% flower or a 75 to 85% concentrate in a vape cartridge. And that will have significant euphoric effects. Whereas the 12-to-1 higher in CBD is not going to have any euphoric effects, simply because CBD inhibits THC naturally.
Sure. And so 1-to-9 products are great for things like pain. Like when I had my knee replacement, I needed something to address the pain, where 12-to-1 is really good for helping with things like anxiety and stress during the day. And you're not going to get high when you're doing that, because CBD really isn't that much. But as we mentioned earlier, these cultivars are now really, strains have been replaced by the term cultivar. Tell me a little bit about those.
Absolutely. Yeah, so strains are more for like viruses and bacterias and stuff like that, where a cultivar is how it's cultivated and how that plant came to be. So cultivars is more of the jargon that we use in dispensaries or on official levels. However, you could come in and say strain as well. That's more of the slang and how what strain you're specifically looking for. And you can also find these strains, like let's say, for instance, Durban Poison is out of stock, and that's a strain or chemovar or cultivar that you're looking for. You could probably find something similar to it in a ratio product, as long as the terpenes are in alignment. And again, we'll see that on a COA, which could be asked for at any dispensary at any given time.
Sure, we'll cover that. Now, there's some other terms that people come up with, for example, like bud, which is the description for the actual flower, the actual bud itself. But also there's things like distillates, right?
Yep, distillates are refined, high potent cannabis concentrates. Distillates can be found in blunt tipped syringes, meaning it's a syringe without a needle on it, so to speak. And you can dab it, you can eat it, you can vape it, you can add it to flour. There's many uses for distillates, but it's also the same thing that you find in your vape cartridges. It's just already in a cartridge ready for you to be vape.
Some people also look at edibles, which some people call in our business medibles. And this goes back to, this could take up to 2 hours of work, but it lasts for potentially up to 10 hours.
It does. And you also want to be cautious when you're dealing with edibles, particularly chocolates or gummies. I know a lot of my consumers like to cut things in half or in quarters to kind of titrate up, go low and slow, which is great. However, edibles are typically partitioned in the dosage that they need to be taken at, and they're not homogenized, meaning that they're not necessarily even all the way through. So if you cut it in half and you take half, you might get no effect, you might get too much effect, you might get the right effect. However, there are some out there that say specifically that they are homogenized and evenly distroed, so you can actually cut them in half and in quarters and take them that way. But otherwise, unless it says that, you might want to take edibles as it's partitioned when you purchase the package.
And that's a good point. But I do also want to point out, edibles, be very, very careful. I mean, there's famous stories of people that will take an edible, 30 minutes later it's not working, maybe an hour later it's not working. So they take more. And then of course, in an hour and a half that it does start affecting, they now have taken more than they really wanted to take. So just be very, very careful. Now let's go down to pre-rolls, because pre-rolls is where the dispensary will roll the joint or the cannabis cigarette for you.
Yeah, so pre-rolls come just as they suggest. They're pre-rolled. They're already set. All you got to do is open the package, take it out, light it up, and you can smoke it. That's what most people are used to seeing, or in the past. That's what it was done. It was always smoke. However, these are pre-rolled and done for you, so you just pull that out, smoke it, and you're ready to keep on going.
Sure. And one of the famous questions I always get is, what's dabbing? Now, dabbing is really important, because fundamentally what the process is they've taken the flower and they've actually combined it and made, by being able to do a number of different things, which we'll talk about in a minute, being able to make it what they call a concentrate. So it's a wax, it's a shatter or something like that. But dabbing is a very important use for cannabinoid, using medical cannabis. probably one of the most effective ways.
It is. What I do want to throw out there is caution because dabbing can raise your tolerance significantly.
Mhm.
Basically, dabbing is going to a higher temperature than vape carts or any other device can do at a normal level. And because of these higher temperatures, you're reaching a cannabinoid called THCV, which is significantly more euphoric. However, it's shorter lived. And that's
Yeah.
why it raises your tolerance because as soon as that wears off and your pain or your symptoms come back, you're right back to dabbing again rather than trying to use other routes of administration. So use caution with your tolerance when dabbing and make sure you use the right equipment.
Yeah, but it is very effective when you do use it itself. Now, we talked a little bit earlier about what they call the certificate of analysis, and this is critical for medical cannabis. I would not try a product unless I could see its COA. And there's a couple of things about this that are important. You want to walk us through a COA?
Absolutely. So COA is basically your certificate saying you're getting an unadulterated product as natural as it can possibly be, and that there's no mycotoxins, heavy metals, pesticides, and so forth. It show you the product type, the potency, all the cannabinoids that are measurable, all the terpenes, which tests it passed. And the reason this is also very important is that even though some dispensaries will have this available online for you before shopping, I think all of them are trying to get there. This is your ingredient list that I mentioned before. If you have this terpene list, then you know what ingredients you're using and you can find similar or like products by shopping around at dispensaries. But then you'll also notice that your product may change from batch to batch. It is a live grown plant, and depending on the weather, depending on the sunlight, depending on the grows, those terpenes and or cannabinoids may change. And just the slightest percentages, particularly in terpenes, can have a significant impact depending on what order they're in. But this is your saving grace as to make sure that you have a product that's certified not only by the state, but by third parties as well.
And when you have a product that works, grab the COA, take a look at the terpenes, and Manny mentioned the percentages. This will give you a good indication of what you should have in your product to be able to be able to address your particular medical condition. COAs are critical, and as you mentioned earlier, Manny, this only has about 4.7% terpenes, which is a small percentage, but these terpenes are very, very effective.
And those terpene percentages are actually growing over time, Mark. I think most dispensaries or grows are starting to realize the significance of terpenes in the products, where they
Mhm.
used to be somewhere between 1 to 3%. They're getting upwards to 6, 7% now to have that significant impact people are looking for.
And also, as from my, like I mentioned, cultivars are being created for a particular purpose. As these cultivars are getting created, it's increasing the terpene levels. So, Manny, now that I'm starting to use medical cannabis, the question is, how do I know, based on what you mentioned earlier about the recommendations, what my recommendation is? How much am I using? How much can I still purchase? This is important.
It very much is, Mark. And this is one of my favorite parts of any consultation because this is where we teach the patient or the consumer on how to navigate MMUR and their recommendations. Now, everybody's going to have access to the MMUR. You can look it up as MMUR, F as in Fox, L for Florida, and you'll gain access with your email and the password that was created by you or with you at the clinic. And basically what this is going to show you is when your recommendation started, which ones are scheduled, how many milligrams were dispensed, how many you have left, how much you started off with. All information can be seen here to include your physician and releasing the physician. And most people usually have this done either for them or don't pay that much attention because it's being done for them, that they don't know that they can get all information that a dispensary has right here at their fingertips on their phone or at their computer. And in this, if you have any questions, you can always call the clinic that you went to and figure out what's going on or have your routes interchangeable. For instance, if you ran out of inhalation, but you don't use sublingual, the physicians may be able, depending on a discussion with you, be able to move those milligrams from sublingual into inhalation so you could get the most benefit of what you're looking for. But I always try to advise people, try to keep a little bit in each route, especially if you haven't tried it, because you might figure out something that you haven't figured out before that might be more beneficial.
And I should point out that when you go to the OMMU, this is the tab for inhalation, but you'll also have a tab for sublingual, a tab for edibles, and a tab for orals as well. So you'll be able to check.
And you may have other routes there too, depending on your physician and the discussion you have for your particular diagnosis.
Yeah. Let's talk about, now that I'm using it, we have a thing called the STAR method. This is where people tend to look at, what are your symptoms and your conditions? And this is where you need to just kind of journal this. Because once you understand your symptoms and conditions, that triggers your product type and the terpenes. And then you have what they call your treatment parameters. In other words, how long do I need to use it? Am I going to use it, like you mentioned, flower works almost immediately, but basically it'll go away in about 45 minutes to 2 hours, where edibles will last, for example, through the night, but it takes a 2 hour duration. This is where you need to take a look at all these different factors. How do I want to apply it? What's the route of administration? What are the terpenes I'm going to use? And also from the routine, am I going to use it in the morning? Am I going to use it midday? Am I going to use it at the end of the day? Or basically a combination of both, because in my case where I have pain management, I've got to use it in the morning, midday, and in the evenings. Your comments about this, Manny, because this is really important where people kind of look at the overall picture, why you're using cannabis and how you use it effectively.
Absolutely. I love the STAR method, not only for taking care of patients outside of the dispensary, but this is something that I use while managing a dispensary to help the med tenders or bud tenders to help patients. You please remember that most, if not all, persons working at dispensaries are not medical professionals. They have no medical training, so they don't know how to dissect your diagnosis if you come in saying, hey, I'm dealing with this, as if you would a physician. So knowing your symptoms, conditions, treatment parameters that you're looking for, application and routine. If you went in a dispensary with these answers already, you're a dream to them, because they're going to be able to navigate with you a lot easier rather than asking them themselves and making it a little uncomfortable at a dispensary, trying to get a little personal, but in the sense of trying to treat you, not to do anything malicious. So yes, please, please, if anything, take this away and know what you're trying to do on your journey.
So, Manny, there also is a lot of talk about rescheduling cannabis. I know that there's the ballot amendment, for example, here in Florida, and this may or may not play before or after the vote. But really, it's important to point out that federally, cannabis has been scheduled. What's the Schedule 1, Schedule 3 thing all about?
Yeah, so Schedule 1 are drugs that are defined as having no medical value and high potential for abuse, which is where marijuana and cannabis falls under right now. There is a lot of emotion with the DEA and the government to reschedule it down to a Schedule 3, which, as you can see, falls under Tylenol with codeine, ketamine, testosterone. We would like to see it descheduled. However, a reschedule will be a nice step in the right direction. So at least research can be done in the States rather than sourcing out to other countries and getting third-hand studies back. And it'll also help physicians understand and be able to prescribe, hopefully at one point or another, if not descheduled for free use, to help those who are really seeking the benefits of marijuana, cannabis, hemp, to find that better quality of life.
Right. I mean, we all know that it's not really a Schedule 1 drug. We know it has medical value. It's important to put it into a category that at least opens up research, banking, and access. Schedule 3 is a good start, although I'm in your league. I think it shouldn't be scheduled at all. But at least it's a step in the right direction, and that's what all the politics and the amendments are all about: is to get it moved off of that Schedule 1 classification. So, Manny, we've covered a lot of topics. Let's summarize, because here's a list of the different, or here's some places where you can look at the different webinars on the different topics like cannabinoids and anxiety. And also, we have some upcoming webinars in October. We'll be talking about next week. We'll be talking about how to use medical marijuana without smoking, how to understand it, understanding cannabis as medicine, how it affects people differently in December, and then also the terpene toolbox, exploring cannabinoids and safe semaglutide. This in both November and December. So they're doing a number of different things. But Manny, give us a summary. We're kind of finalizing our discussion here. We covered a lot of terms. What's your thoughts?
Yeah, so I love how you have these sources up here, Mark. That's a great start, because there's a lot of rabbit holes out there that may intersect. However, all these bit.lys that you have here are going to be very specific and very to the point of what you're looking for. So please take advantage of that and figure out what journey you want to go on. And also remember that this is not typically like going to a regular physician, getting a prescription, and then going to a pharmacy. You have any questions? No. Okay, here's your prescription. If you go to a dispensary, take your time. They'll be happy to sit down with you. They have consult rooms by law from the state that they could provide privacy and discuss with you certain things. And go low, go slow, and find out how marijuana could really help you.
Sure. And I should point out that follow us on not only on YouTube, which is probably what you're going to be looking at this from, if not the webinar itself, because we have not only about terminology, but we have also conditions and things like that. You find us on Facebook and also email us with events at marijuanaaware.com. And I want to thank you all for joining. And if you like this particular video on YouTube, please like and subscribe for us. Manny, any final thoughts?
And I appreciate the time everybody's given to watch this video. Marc, for allowing me to present with you. It's a great thing to do that I love doing. And I just like to throw out there, you can also find me, if not here on Marijuana Aware, at thebluntjoint.life.
Great. And we'll publish that and put that on some of the notes that we have on YouTube. And I do want to thank everybody for joining us. Our goal with this is to help you get your life back. And hopefully this, by understanding the terminology in the medical marijuana business and the medical marijuana world, it'll help you do that. Thank you for joining us.